Hi guys, we are going to discuss the complex amalgam restoration. It's called complex because one of the cusp is missing, and in the exam we need to replicate the anatomy to the extent that looks like the original tooth anatomy, because that comes into one of the criteria. So before that we need to understand the basic anatomy. So what we can see in the tooth over here is on the buccally we can see there is a mesiobuccal cusp, there is a buccal cusp, and there is a distal cusp. In the exam, they do ask the mesiolingual cusp and the distolingual cusp as a missing cusp. Buccal cusp, mesiobuccal cusp is divided by four grooves: the buccal, mesial, distal, and the central. The buccal cusp is little bit towards the lingual side in a V shape, and the distal cusp ends little bit above the contact area. Mesially, you can see the it will have the contact which is the V shape, and the cusp is also having the curvature. So you need to create the same anatomy you can see in the clinical picture. So the kind of the cavity you are getting is displayed over here. Double check the contact has been removed while you create the anatomy, and when you use the amalgam it should create the same. Hi guys, let's have a small video on how to do the basic anatomy once you're done with the amalgam restoration filling. So try to condense your amalgam perfectly. Do it increment wise and use proper pressure until your wrist hurts. While you remove the band, I suggest do not remove the wedges because the chances that amalgam breaks are high. Now we are doing the carving on the lingual part. We are keeping the instrument, half of the instrument on the tooth surface and half on the restoration, so we will not get any ditch. First plane will be on the parallel to the tooth surface. While we are doing the cusp part, we can keep it at the angulated part. Now on the distal side, we are going to create the distal cusp. Just remember, the criteria is about matching the marginal ridge height. Distally, you will get the distal cusp tip, which will always be little bit high. While you are doing the mesial part, you need to create the mesial triangular fossa. So keep that in mind. And the mesially, you will get the V-shaped area when you see from the side. So try to create that V-shaped part on the mesially in the contact area. The contact will be little bit more buccally on the mesial part. Here I'm doing the basic anatomy, keeping my instrument at the angle of the 30-degree, half on the tooth surface and half on the restoration. So it will not create any ditch. Okay, so I'm lowering down the marginal reach height little bit, because if it's high the restoration can break and it can come to the straight fail criteria. Just remember that while you are doing the carving, the amalgam should not be set, it should be in a carvable area. Here we are creating the cusp, so we are doing at the angle of 45-degree, and both the sides we are swapping up the extra amalgam. So it will create a high portion in the central and the depression on the side. So we are almost getting over there. One of the criteria is there should not be any extra debris. So if there is any debris we can see on the tooth surface, you can just use the spoon excavator or any instrument to remove the debris. But be cautious that you will not create any ditch while you are doing that. In the end, you can use the high suction to remove the debris from the backside of the throat. And while you are doing the carving, I suggest try to use the cotton roll in between. It will give very good shine and the polishing. Here in the end, I am using the applicator tip, but you can use it in between while you are doing the tooth carving also. So in the end, double check all the criteria, whether your marginal ridge height is equal to the adjacent teeth or not, whether the cusp height is okay or not. One of the criteria is maintaining the cusp contour. So you need to get the two slopes while you are making the cusp. Okay, and there should not be any ditches. If there is any ditch, just take the amalgam which is not set, and while the add some little extra, and you can just condense on that part only. Here we are checking the contact. Contact should not be too tight or too light. If it's there is no contact, it directly fail. If it's too tight, means there is a cervical overhang, you have not done the separation enough, and you have not done the burnishing of the band enough. So try to select the proper wedge. Number 3 number wedge is, I think, enough every time. They give a wide contact mostly. And try to burnish your band very good manners. Once you do the condensation, try to fill up the boxes part first, and then condense in the central part. So try to get your contact area part first. Okay, so in the end